Hi, my friend Sam here. I want to talk today about reasons for tourniquet failures. We'll go through a few different categories and then focus on the last one. But let's just dig in here. One category is transport. Maybe it's just very bouncy, lots of vibrations, and tourniquets come loose. You lose arterial occlusion. Maybe the issue is with your patient. They have a very large limb. As I've talked about before, it's hard for every tourniquet to stop blood flow the larger the limb. Maybe the bar is just higher. They have hypertension. Maybe they have calcified arteries. So I remember during residency, I had a patient I just could not get a blood pressure on. We did x-rays of her limbs and she was just calcified. So she had essentially lead pipe physiology. There was no amount of pressure that was going to stop arterial bleeding in this patient. Maybe they're very combative, so they're moving around a lot. They're scared, and combative is not shocking. This is frequent, so it's difficult to get arterial occlusion on somebody that's moving around so much. Maybe they're just very slippery. They have blood, vomit, other slippery things on them, and it's difficult to get the tourniquet applied. Maybe it's an issue with the rescuer. They just don't know. They don't have the training. They don't know you have to tighten to the point of arterial occlusion. Maybe they chose a bad site. They put it over somebody's keys, a gun. Maybe they put it over a knee or an ankle joint. Just picked a bad spot. Maybe they just did a weak first cinch. So that's an issue with windlass and ratcheting type tourniquets. So you do a weak first cinch, then you start cranking, and then you just run out of travel. Maybe they don't have the dexterity, so it's very cold, or their hands are weak. They can't get things tight enough. Or maybe this is something we don't talk about much, but empathy. So you have a patient who's screaming and you say, hey, I'm going to make you scream more by putting this tourniquet on. So if you have somebody who's nice, they may fall short thinking, well, I don't want to make them scream more, when in fact, if you're putting a tourniquet on, you need to make sure the arterial flow stops. Maybe it's a gear issue. So you have broken plastic or metal parts. We talk about this all the time with the knockoff cat tourniquets. Maybe just ruptured seams, ruptured fabric. Maybe you have a dislodged anchor point. So this is an issue more for like the SWAT T or ESMARC. If the beginning or the end isn't anchored well and it comes unraveled, that's no good. Also, like for pneumatic tourniquets, you could have a ruptured bladder. So if for whatever reason something releases the air, that's bad. You've lost arterial occlusion. But what I'm interested in is this last category, hydrostatic. So anytime you apply external pressure to a limb, think of your grandfather's calves with socks. If you apply external pressure for a prolonged time, fluids move to areas of lower pressure. So that's even if you have no bleeding at all. Fluids just shift. But what if you have fluid losses? You have fluid, blood in particular, pouring out onto the curb. There's less fluid underneath that tourniquet. And so you have less pressure in there and then potentially lost occlusion. So what I want to do next is a little study that demonstrates differences between elastic and inelastic tourniquets. This is a follow-up to a previous video that I did. So, all right, let's go to it.